When the patient makes an appointment, they come to see one of our consultant surgeons in Hair Restoration Blackrock. The surgeon will take a history about their general health, about their hair loss history, about their family history of hair loss, about any medications they're on, whether they've had operations or serious illness in the past. Then the surgeon will examine the patient's scalp to assess, first of all, their degree of baldness, secondly, the amount of donor hair they have if they're contemplating hair transplantation. The patient is then photographed and the photographs are put onto the computer. A detailed discussion then takes place between the surgeon and the patient. First of all, the surgeon has to assess the patient's realistic expectations in relation to the amount of donor hair they have, in relation to the amount of baldness they're developing and will develop in the future, more importantly. At the same time, the patient is assessing the surgeon, seeing if this is somebody they can trust. At the end of the consultation, the surgeon will advise the patient of one of the four possibilities: to either accept their hair loss and get on with their life, to contemplate using the medications, to contemplate having a hair transplant, or possibly to even have a hair transplant and combine that with the medications which will help their existing hair. The patient will take home with them a book about hair loss and its treatment, their own photographs on a USB stick, and a DVD showing the actual procedure of hair transplantation. By doing this, combined with the report that I also send them, they're in a much better position to make an informed decision. They can also have an in-depth discussion with their family, their friends, or somebody that they trust. Every hair transplant patient I have ever seen has unique problems and also a unique solution to their problem. And this is what makes hair restoration surgery a fascinating specialty. I've never treated two patients the same way.